primary consideration for weight training for osteoporosis is proper medical screening and evaluation, including health history and current health status. A bone density test is essential to obtain information about the specific regions of bone and fracture risk and to monitor change in bone over time. Assessment of exercise history, current exercise participation, joint stability, flexibility, and strength is also appropriate. Weight training to maximize bone health should be performed for a minimum of 1 year at moderate to high intensity, 75-85%, 1 RM, or at 8 to 12 RM intensity. 3 sets of 8 to 12 repetitions performed 3 times per week for 6 to 12 total body exercises provide the optimal stimulus to bone. The exercise selection must be in accordance to the fact that osteogenesis is mediated by the force of muscle contraction at the site of the tendon attachment to the bone. Thus, the most beneficial exercises for bones use muscles that originate or insert at the bony landmarks of interest because they provide the most direct site-specific mechanical load on bone. Exercises that involve the 6 deep external rotator muscles of the hip, gemellus inferior and superior, obturator internus and externus, quadratus femoris and piriformis, and the adductor muscles, adductor brevis and longus, pectineus, might contribute to significant increase in femoral neck, BND, leg extension and flexion and hip extension and flexion exercises, including leg presses and squats stimulate bone at the proximal femur. Back and hip extension exercise, lat pull down and rows that engage the deep muscle of the spine and the superficial muscles of the back have been shown to be effective in maintaining or increasing lumbar spine BND. Bent knee deadlifts and cleans are advanced structural exercises incorporating back and hip extension that are also effective. The exercises that use brachioradialis and pronator quadratus muscles and joint actions as the arm curl with forearm rotation, wrist pronation and supination, as well as wrist curl and reverse wrist curl, result in significant increase in wrist BND. Weight training is a potent prevention and treatment strategy for osteoporosis and may be most successful when combined with adequate intake of calcium and vitamin D, lifestyle modification, and medication. Also, weight training must be performed at the proper intensity, volume of loading, number of exercises, sets, repetitions, and be of sufficient duration to increase BND. Varying exercise selection, changing the direction of the force applied, including structural exercises and exercises that allow greater absolute loads may be of additional benefit to bone. That's all for this video. Hope you all enjoyed the content. Please comment down below. Also share, like, and come back whenever we want. It'll be a pleasure to have you back.